Hello, and welcome to this keynote talk, which I've entitled Reframing the Path to Becoming Expert. My name is Roger Kneebone. I'm Professor of Surgical Education and Engagement Science at Imperial College. And I'm going to draw on ideas that I've been developing over a number of years and my book, Expert, Understanding the Path to Mastery, which was published by Penguin Viking in August last year, August 2020. I lead the Centre for Engagement and Simulation Science at Imperial, where our aim is advancing human health through simulation. And I also jointly lead the Centre for Performance Science between Imperial College and our very close next door neighbours, the Royal College of Music. For those of you who are familiar with this, just round the corner is the college from the front, and looking from Imperial over the back of the college towards the Royal Albert Hall and then northwards, of course, over Hyde Park, gives you a sense of how close these institutions are. I'm also very fortunate in having been invited to become the 14th Professor of Anatomy at the Royal Academy of Arts in an unbroken line since the first holder of that post in 1769, just after the Royal Academy was founded. And this is William Hunter, one of the two very famous Hunter brothers, William and John. And William was an obstetrician. He was at his time a leading anatomist and a practical clinician, and he worked very closely with a number of artists, particularly Jan van Braamsdijk. And a lot of you will be familiar with this image, the anatomy of the human gravid uterus, which is justly very famous, and I think gives a sense not only of a sort of the beauty of the craftsmanship of this drawing, but the sense that William was not only an anatomist, but he was concerned with clinical practice, with actually doing things that had consequences, delivering babies. And so for a long time now I've been thinking about the worlds of science and medicine particularly as points of intersection between scientific knowledge, of course that's essential, specific craft skills also essential, but also performance, because very often it's the performance that other people are particularly aware of, whether that's patients or audiences or customers or clients or all kinds of people. And in this book I've drawn on many conversations and collaborations over the years that I've had with experts. More than 20 of them appear in the book itself, and I'm going to draw on some of those over the course of the next 40 minutes or so. But if you'd like to find out more about them, I direct you to my podcast series called Countercurrent, which I've been running for several years now, with almost 150 conversations, usually 45 minutes to an hour, with people who have, I think, diverse and very interesting perspectives, and almost all of the people in the book appear in that series. So if you're interested, either follow this link or just put in Countercurrent and my surname Kneebone into your search engine, and it will pop up. So let me give you an outline of the ideas that I've followed in the book. The idea of becoming expert, of course, goes back for a very long way, and in the book I draw on the well-known medieval model based on the guild system of a progression, a series of steps where you start off as an apprentice, working in somebody else's environment, doing what they tell you. After a number of years you become skilled enough to go out into the world as a journeyman, as an independent craftsman, plying your craft or your trade, often moving across your country, hence journeying, and then finally becoming, in your turn, a master and taking responsibility for other people who are following in the path that you've chosen. And of course these words seem gendered, and these days of course we use them in a non-gendered sense, but I think this still gives a sense of a progression. And it's a useful model because it's familiar to many people, but it's incomplete because it describes what happens, but it doesn't really explain it, and it doesn't really get at the inside story of what it is to go through these steps. And in the book I use that division into three categories. There they are at the top: apprentice, journeyman and master, to look in more detail at each of these stages and to try and paint a picture of what is going on inside us all as we are going through those stages, because my argument in the book is that we are, all of us, on a path towards becoming expert in usually many, many different areas of our lives. It might be our profession, it might be an interest we have, it might be learning a language or a sport or playing a musical instrument, all kinds of things. But whatever it is, it involves a process of gradually getting better and going through a series of stages. And so the apprenticeship stage is one where you focus on yourself, on gaining skills, very often doing things that you don't particularly enjoy at the time, but they turn out later to have been very useful. And in the process, you're learning to work with materials and tools and other people. The next stage, when you become independent, you're going out into the world. And I think there are two crucially important shifts that I'm going to talk more about in a little while. One is shifting your attentional focus from thinking it's all about you to recognizing that it's all about other people, the people for whom your work it makes sense. But at the same time, it is about you in the sense that you are developing your uniqueness, your individuality, your personal style. And then the final stage of passing it on is equally, though differently interesting, I think, because then you are widening your focus. You're taking responsibility for guiding and helping other people and sharing not only your knowledge and your skill, but your wisdom with people whom it can benefit. But it does raise a question, I think, to begin with, of what is an expert, because this is a word that's bandied around quite a lot. And in the first part of my talk, I'm going to look at what becoming an expert involves in the world that we have been very familiar with until recently. And then in the second part of the talk, I'm going to explore what has changed with all the convulsive changes really brought about by the COVID-19 pandemic, and many of the changes that we're all encountering in how we communicate particularly and relate to other people. But I'm going to start by asking this question and answering it by giving you an example of a taxidermist, Derek Frampton, whom I met several years ago. He's a leading expert in his field. He's been a taxidermist for over 40 years, and when I first met him, I went to see him in his workshop, and he was posing, as he puts it, this clouded leopard and her cub. I'd never seen a clouded leopard before, and I was just astonished at the beauty and the accuracy and the lifelikeness of this creature with her tiny cub. It turns out that Derek, too, like many of the experts in my book, sits at an intersection between scientific knowledge and craft and physical skill and, of course, art. And his work, I think, exemplifies this point of intersection, because his work has to be very scientific. A lot of the time he's dealing with animals from zoos. Sometimes they're species on the verge of extinction, or he might be working with specimens that have been prepared by other craftsmen, and he's having to do things to them. So he has to have very detailed, very precise scientific knowledge, as you see with all these measurements from an animal he was just about to work on. He needs extraordinary skills himself, of course. Here we are in his workshop, and here he's demonstrating the work that he's doing on a tiny frog.
On there, and then it can be modelled in, and
a small number,
and you can turn it round,
and he works with animals and birds, with fish, with reptiles, with big ones, with small ones. And I asked him how he actually does it, and he said, well, take this clouded leopard. It's pretty straightforward, really, Roger. He said, the first thing you do is you take off the skin, and then you cure it, you prepare it, and then you just sculpt a clouded leopard that size and shape, and you put the skin back on. And to me, his use of that word "just" was really telling, because to me it's completely unimaginable that anybody could sculpt any clouded leopard, let alone one that was exactly that size and shape so that you could put the skin back on. But to Derek, having been doing it for over 40 years, he had put together all those different components of his craft and his work to make it possible to talk in those terms about something that to me was unbelievably skilled and unimaginably remote. And we see this, I've seen this with lots and lots of different experts. So here are a couple of examples. Andrew Garlick is a harpsichord maker. He too has been making harpsichords for over 40 years. This is what his instruments look like. For anyone who's not familiar with the harpsichord, at first glance it looks a bit like a piano, but it works completely differently. Instead of hitting the strings with a hammer, it plucks them with a little plectrum on the other end of each of those keys you see there. And Andrew makes these instruments, which are based on a harpsichord in a Paris museum, an instrument from the late 18th century, and he makes every aspect of these instruments himself. So in his workshop here we see a sort of unpainted case in the background with some components inside it. Here he's painting the soundboard. He is able to create any kind of design that people want, and paint and decorate the case. But of course, a harpsichord, in order to make sense, is something not only to be seen but also to be heard and to be felt and to be played. And so here's just a brief glimpse of him just putting one of his instruments through its paces. So here is something that he's made and created for other people to use. Now, in my own experience, I've got a very different background. My background's medical, and I think these same ideas play out in the worlds of medicine and surgery. So I'm going to take you back just for a glimpse of my experience in the first phase of my career when I was training as a general and trauma surgeon, and I spent a number of years in southern Africa, starting off in Soweto, just outside Johannesburg in the 1980s, which at that time was one of the most violent parts of the world. This is the township of Soweto with a population of well over 1 million people. Nobody knew exactly how many because there were no accurate census data. And the hospital I was at, Baragwanath Hospital, now Chris Hani Baragwanath, catapulted me into a world that I hadn't experienced. I'd trained as a medical student and a junior doctor in the UK, and then to find myself in this environment where everything was just completely different from what I'd expected. Patients, huge numbers of patients. This is the surgical admission ward after a busy intake with perhaps 150 patients on the ward, many of whom had big operations or serious injuries. But many of the patients were young men, and they were fit, and so this is a couple of those patients. The morning after they'd come into hospital with stabbed chests, with collapsed lungs, and you can see that the young man in the centre of the picture there is holding a glass bottle, which is allowing the blood and the air to drain out of his chest cavity so that his lung can re-expand. And on his head he's got the bag of intravenous fluid that's going into a vein in his arm, and he and his and the other patient at the left of the picture are sort of undergoing almost physiotherapy by walking around the hospital grounds under the watchful eye of the nurses over there in the middle of the picture on the left. I was catapulted again into the world of operative surgery. Here I am on the right, leading a surgical team in the middle of the night. A patient who's had a pretty serious injury, many serious stab injuries, for example, with a team of people. There's the scrub nurse on the right, my first assistant opposite me, the anaesthetist on the left, all of us in our sort of mid to late 20s. And this is very much a social as well as a technical activity, social in the sense that it is jointly constituted by a number of people working very closely as a team. And a lot of the things that I've described so far are around, I think they're around engaging physically with the world, around doing stuff. And so this first stage in the pathway I mentioned, this apprentice stage, is one where you're coming to grips with that physical world. And I've called these first 3 chapters in my book Doing Time, Using Your Senses and Space and Other People. And so the idea of doing time, I think, is an interesting one, because it's a question of actually getting involved in the physicality of your work and spending a long time doing it. And for me, that involved a process which I imagine many people watching will be familiar with, of moving from abstracted conceptual ideas, often simplified as this picture of the abdominal cavity might appear when you're at school studying human biology, to a much more complicated but still abstracted view of the body, which is what I encountered when I started at medical school, with lots more structures and lots more names, lots more stuff to learn, but still laid out so that anybody can see it, with red arteries and blue veins and yellow nerves, and that sense of order. But when I got into the dissecting room and started dissecting cadavers under supervision, I found that it was completely different, because everything was grey, and it didn't give me that sense of a navigable landscape. I had to try and make sense of what I found, and then I had to convert that again into what this looked like on living human beings. And I've never forgotten the experience when I first started as a third-year medical student, taking blood from patients. This was in the 1970s, in hospital with minimal supervision, when I tried to convert the theoretical knowledge I had into the practical challenges of actually using a syringe and a needle to get blood from patients, when I really didn't feel that I had the skills yet to do that. But gradually I became more experienced, and then I started to take part in surgical procedures, as I've shown, and to engage with those physical characteristics in a different way, as we see in the simulation here. We're having to learn to deal with living organs that move and behave in characteristic ways. And of course, nowadays a lot of that kind of surgery has been transformed by the introduction of keyhole surgery, with its very different environment, where you're looking at magnified versions of the things that you learn about in medical school and through textbooks, and you have to come up with different ways of engaging with this physicality. But whichever way you're looking at, it's still about people working with other people to do things. Very often things that have consequences and have serious implications if they go away from what you expect and hope. But nonetheless, it's a collective practice. So I started thinking about what are the processes you have to go through to become skilled at doing. And here I'm going to introduce Joshua Byrne, who's a bespoke tailor I've been working with for over 10 years now, who's really helped me shine light on what's going on here with this question of becoming expert. So much so that world of tailoring inspired the cover of the hardback version of the book. Now, Joshua, too, occupies an intersection between science and art and performance and skill, and so here is the kind of symbolic representation of a suit or a jacket that he might create or work with. But then, of course, he has to actually do stuff with the materials he's working with, and so just a brief glimpse of him putting on a sleeve onto a jacket, or working with the collar of a jacket, things that look very straightforward when you see them in the hands of the master, but are actually far more difficult than they look, far more complex. And I asked him how he came to be able to do all this, and he described his first apprenticeship, which was a 4 or 5 year apprenticeship as a making tailor, a jacket making tailor. Joshua had an interesting trajectory in that he was studying economics at university, when in his second year he decided that actually that wasn't really what he wanted to do. What he wanted was to become a tailor, and so he left university and became apprenticed to a jacket maker. And one of his early tasks was to make pocket flaps. These are the flaps that go over the pocket of a jacket, which look very straightforward and but are actually much more complicated than they look. And his was a fairly traditional old-style apprenticeship, where he would sit there at a desk or a bench for hour after hour, trying to make pocket flaps that his master would be satisfied with. And every so often his master would come along and would just sort of look down his nose and shake his head and say, no, not good enough. And Joshua would have to make more pocket flaps. And to begin with, he just didn't know what the problem was. His master wouldn't tell him. And so he just had to do it again and again and again. But by doing it again and again and again, he found eventually that he did start to recognise the difference between good work and not good work, and started to understand what he was aiming at. But it was very boring, it was repetitive, he hated it, and he wondered why somebody else couldn't do it instead. But in retrospect, he told me, he recognised that process of spending all that time making pocket flaps was invaluable, partly because as a tailor, he needs to know how to make pocket flaps, of course, but partly because it gave him an understanding of that need to do things again and again, because at university he said he was quite used to grappling with a concept, learning that concept, and then moving on to the next one, applying what he'd learnt, and it was a fairly quick process. Whereas with the making the pocket flaps, he could understand right from the beginning what it was he needed to do, but it took him years before he was actually able to do it. And so that repetitive work was essential in laying the foundations. It was also essential in giving him that lived experience of being bored and coping with being bored and not giving up, but finding ways to make that work in some way interesting. And it's a process you see all over the place with lots of other people. Paul Journeyman is now the head of historic stone carving at the City and Guilds of London Art School, where the stone carvers who are going to be having careers in restoring statues on Gothic cathedrals or working in the conservation departments of museums like the V&A, they go through this. Most of them go through this department. But he said when he first started as an apprentice, he wasn't doing that kind of work at all. He was either he was sweeping up the floor, or he was just spending hours and hours, months, very often with a hammer and chisel, just learning how to make a completely flat, horizontal or vertical surface. Again, drove him out of his mind with boredom, but in retrospect, it gave him that experience, not only of being able to make perfectly flat surfaces, but of what it was to work with the materials, the different kinds of stone with their different kinds of characteristics, and the materials that he worked with. And that's led on recently to an interesting collaboration that I've been leading with a colleague of mine, where this is the City and Guilds of London Art School, and on the left is Paul Journeyman, whom I've just introduced you to, but on the right, Malik Rassi, who is an orthopaedic surgeon in training, and they're exploring, they're talking to one another about the tools and the instruments that they use, because they both deal with sharp tools and hard materials. But actually you'd be quite hard pressed sometimes to distinguish between which are the orthopaedic surgeon's tools and which are the stone carver's tools out of that group on the table. And that led on to another of my colleagues, Ms. Sam Gallivan, who's a consultant level hand surgeon, who's been working with me on a number of research areas, who broadcast a 20-minute item on the BBC Radio Forethought project about the craft of surgery and how surgeons learn what to do, not only by gaining conceptual knowledge and facts, but by using all their senses, by, for instance, learning to recognise when a bone is in danger of cracking by what it sounds like when you hammer it. Not just what it looks like or what it feels like, but the landscape of sound that using sharp tools and hard materials provides you with. So by doing time, you are learning to use your senses. You're learning to get a sense of the materials you're dealing with. But you're also almost always you're working with other people. And somebody who's been very helpful to me in understanding this is Fabrice Ringuet, who's a distinguished hairstylist. For a long time, he was the head of training at the Tony and Guy Academy, and of course he himself has been through a long apprenticeship, and now he's teaching people how to do the physical aspects of cutting hair. And indeed, I invited him several years ago to come and join a session with the Masters in Education, in Surgical Education program I lead at Imperial, and here he is showing the surgeons in training how he deals with, in this case, an inanimate mannequin with long hair that shows some of the technical procedures that he uses, but actually much more difficult to gain, he said, was the skill of being able to approach somebody he hadn't met, who could only see him in a mirror, and give them the confidence to allow him to enter their personal space and do things, to wash their hair or to cut their hair, to touch them and to handle their hair while he was doing his work, that gave them the confidence that he was indeed an expert and was able to relate to them. And that, I think, is something that we see in many areas, certainly in the area of clinical practice that I've spent so much of my career doing. That ability to engage with people and to enter their personal space without freaking them out or making them feel uncomfortable is crucially important. So that's the apprentice stage, and now I'm going to just say a brief word about the journeyman stage, which is when you have you've got to the point where you know enough about what you set off out to learn to go out there and do it for real, if you like, in the real world, and you're then in a different world because you're taking responsibility as an apprentice. Your master has responsibility for the work that you do. They take the credit for the good things you do, but they also shield you from blame when you make mistakes, as you always will. But when you become a journeyman, you go out on your own. You're applying your craft. It's a different story, and you're taking a different kind of responsibility. But you also, I think, have to make a couple of crucial changes, and one of them, the first one, I've called "It's not about you." This is a phrase I gathered from a very expert close-up magician, Richard McDougall, who's sitting there in the centre with the grey top on, at an event I organised at the Art Workers Guild, which is here, bringing magicians and surgeons together to explore what common ground they might have, and you can see some surgical instruments on the in the foreground. And Richard, he said, he spent years and years when he was a teenager largely learning to do extraordinary things with coins and cards. Here's another magician doing the kind of thing that magicians need to be able to do as part of their craft. But Richard said, but actually that's just dexterity. That's not magic. It's only magic if somebody watching you thinks just for a moment, perhaps, that something quite impossible has just happened. It's not about you, it's about them, it's about whoever's watching you. And so I'm going to just introduce you now to another magician, Will Houston, with whom I've been working a lot, who's showing a brief glimpse of a trick that he's well known for doing, a piece of magic, watched by those other magicians. And I want you to see not only what he does with his hands, but how he engages with that audience.
Now, I'm not going to touch them. Instead, I'll keep my hands just slightly over the top all the way through. Now, hopefully, if I give a little wave, one of the coins will jump, followed by the second, and then the third. Another wave, one goes back, second goes back, and the third goes back, and then covering them all for just a second. They all make their way together.
And you can see that Will is having an enthusiastic response from the other magicians, but I hope you could also see that he is engaging in many, many ways with the people who are watching. It's not just about what he can do with his hands, extraordinary though that is. But at the same time, as it's not about you, at the same time as recognising that your work is about those people for whom you've learnt it. It's about your client if you're a tailor, it's about your patient if you're a clinician, it's about your audience if you're a magician or a musician, it's about your customer perhaps, or it's about other people. At the same time, it is about you because you are developing what the jazz musicians call voice, and that's what comes after all those years of learning to play your instrument and scales and arpeggios and repertoire and listening to other people and playing with other people. When you are able to present yourself, and so if you are interested in jazz, for instance, you can immediately tell when you put on a record and you hear Miles Davis or something. You know it's Miles Davis, it's not another trumpeter. Miles Davis is not an interchangeable cipher. He is uniquely him. And we all do that. And I think that's part of becoming expert too, because all clinicians or all magicians or all teachers are not interchangeable ciphers. We all have our own individuality, our personality, our style, what makes us us. But in order to develop and to hone that personality, we have to go through a lot of things, which I haven't got time to go into great detail at the moment. But all the experts I've talked to, and certainly from my own experience, there is an awful lot of getting it wrong and having to put it right. And of course the stakes will change according to where you are along the path, and the approaches that you use will change, but it is an inevitable part, an inescapable part of being human, that you will get things wrong, and then you'll have to try and do something about it. And I think when you put all that together, you see something towards the end of this journeyman pathway, and as we're getting to the sort of final stage, which is about being able to improvise. Now, I think improvising often has a bit of a bad name because it kind of sounds to people as if you haven't really been able to be bothered to do it properly, and you're just sort of pulling some things out of thin air and knocking something up on the spur of the moment. But I don't think that at all. I think it's quite the opposite. I think the ability to improvise is a hallmark of the highest levels of being expert. And I'm going to bring in a musical example here now with two very expert improvisers. David Dolan is the professor of classical improvisation at the Guildhall School of Music, and his colleague Thomas Carroll, equally distinguished cellist. And I'm going to just show you a glimpse of an unusual approach they took in a performance of Schumann's fantasy pieces. 3 pieces by Schumann, written down couple of hundred years ago. But instead of playing, this is a public concert, but instead of playing exactly what Schumann wrote, they will play what Schumann wrote, but they start by improvising a sort of prelude in the style of Schumann, and then in between each of these scored pieces, they have a sort of interlude where they improvise again. We're just going to join them for just a few minutes right at the beginning, and I want you to think that here are 2 musicians who have not decided in advance what they're going to do now. We're going to hear them play something that will lead in to what Schumann wrote, but they haven't rehearsed it, they haven't designed it. They've just agreed to come together and attend to one another as they collaboratively come up with something that will lead into this piece of music by Schumann. And you can see when the transition happens, because David, who's at the piano, you'll see him look at the keyboard as they play together, and then when the introduction stops, you'll see him pause for a minute and then look up at the music, which is what Schumann wrote, and then we'll have to leave it there. But let's join them as they start. And so that's the beginning of the Schumann. That's where we have to leave it. But I hope you'll agree that that is not something just knocked up on the spur of the moment without being able to be bothered to prepare. That, to me, is an extremely high form of collaborative artistry, and that's what I mean by improvisation. Well, finally, we get to the stage of mastery, where this is about passing on to other people not only the knowledge and the skills that you yourself have accumulated over many years and usually decades, but also, I think, developing the wisdom to help people make decisions about what to do, make choices. Sophie Yates, very distinguished harpsichordist, here she is with one of the instruments created by Andrew Garlick, whom we met earlier. Sophie is a recitalist and a recording artist and a teacher, a very gifted teacher. I've been fortunate enough to have lessons with her for many years at a very early stage, but nonetheless have experienced her abilities as a master, I think, which go far beyond specific technical points about this passage or that passage. But Sophie is able to think about all the people she teaches, all her pupils, whether they're 12-year-olds just beginning to learn the piano or whether they're very experienced people exploring the harpsichord repertoire, to look at those people in the round and to think what kind of help, what kind of guidance can she give them in moving ahead along their pathway less far advanced than she is. And I think this whole question of mastery leading to not only to skills and knowledge but to wisdom is a really important one. And I'll pick up that a bit in this final part, where I want to look at things that are beginning to change. So we've spent a lot of time now looking at people who become very expert in things that involve doing. They involve doing stuff. But of course, the pandemic has radically changed, I think, our relationship between doing and communicating particularly. And in a sense, the change that was forced upon us over a year ago, certainly in my experience with teaching and learning and lecturing and things like that, but also all those interminable Zoom meetings, have meant that a whole lot of things that I think we took for granted, having become expert over many years in how we communicate with other people, how we interpret facial expressions and levels of attention, eye contact, gesture, all these things that we take for granted, means that in a way we are being put back to an earlier stage along that path towards becoming expert, and we're having to rethink things that we took for granted, even things as apparently second nature as communicating with one another during a conversation, especially a conversation with several people. And so there's something, I think, very interesting about what the pandemic and its implications are doing to us in making the familiar strange again, making us rethink what it is to do the work that we do. And here I'm going to come back to Will Houston, the magician you saw with those doing those things with those 4 coins, who for a number of years now has been the magician in residence at the Imperial Royal College of Music Centre for Performance Science, which I mentioned right at the beginning of my talk. And Will has been he's been thinking a lot over the last year, he tells me, about what it is to perform online, because many of the magicians he's worked with have been shedding tears over how difficult it is to do the kind of magic that they've been used to doing for years and years and years with a live audience online, and seeing the online environment as a sort of impoverished version of the real thing. But actually Will and some of his colleagues have been reframing that and saying, instead of that, think what new opportunities does the online world give to perhaps come up with different kinds of magic. And I'm going to show you just a brief glimpse now of an approach to magic that Will has been developing. And I'm taking you to a Sky News item, very brief, on television about Will's new magic show called The Secret Connection, which I was fortunate enough to be able to go to. And here we join him as he's explaining what he's doing.
Now, as a member of the Magic Circle, Dr. Will Houston has been practicing and performing magic for 25 years. But due to the pandemic, like most of us, he's had to move online. He's now offering an interactive magic show, The Secret Connection, exploring the art of magic over Zoom. And Dr. Will Houston joins me now. Good morning to you. Lovely to see you this morning. As I was saying, like many performers, you've had to go online and adapt. Tell us exactly how you've done that with this new show.
Absolutely. So we've developed this new show, The Secret Connection, and essentially it's an online magic show that happens entirely over Zoom. So friends, families, colleagues all get to log on to this. They all get to have the experience of seeing this show together, but rather than it just being something like a TV program that you have to sit back and watch, it's something that people can really get involved in. We even send people out a box of special props so that some of the magic tricks happen in their hands, in their homes, as they take part in the show.
OK, well, I haven't got a box of props, but you've got a trick specially devised for me, haven't you?
I do have a trick specially devised for you, yes, absolutely, which is actually a trick all about planning the show. So I have a few little cards with some of the things that are particularly important about the show. We've got magic, of course. I haven't had a chance to do that for a little while. It's nice to be back. We have interaction, because it's very much that two-way show, and friends and family, because the idea of bringing people together is so important. Now, just before this call began, Gillian, I decided which one of these I think is the most important. And I made a little bit of a mark on the back. And I'm hoping, even though we've only spoken for a very brief time, the connection we now have is enough that you'll pick up on which one I think is most important. So, Gillian, which of these 3 different things do you think I would think is most important?
I'm going to say interaction.
You're going to say interaction. Well, that's very interesting, because friends and family is really important. but is not the thing that I thought was most important. Magic, of course, super important, but not the thing I went for strongest again. However, interaction, the thing that you chose, is the thing that I also chose. I put a great big mark on the back. I guess that proves we have a little connection going already.
That is really still very thrilling, even over online. It's really. I wasn't going to go for that, first of all, and I changed my mind halfway through.
Oh, thank goodness. Thank goodness.
But mind reading is something that you can do as well, and part of your show.
Yeah, so absolutely. So reading minds is an interesting thing. But one of the fascinating things about magic on Zoom is tricks which maybe wouldn't be so exciting otherwise can be really exciting in this setting. So pick a card and I'll find it is never a great trick when you're in the same room. If you have somebody in Australia picking a card, somebody in America picking a card, and somebody in a studio in London managing to find those cards, then suddenly that's a whole different thing.
So we're going to leave things there with Will, and I wanted to point out with that, I think that Will is doing a number of very, very interesting things there. First of all, he has paid a lot of attention, I think, to how he comes across, to his background, to his how he's framed in the picture, to the lighting, and to how he manages to make eye contact with people by using the technology to give a sense of being actually there. But I think he's also giving a sense of the kind of possibilities that he is exploring, that the online environment offers, that other people might not think about. And it's been very interesting working with Will in his capacity as our magician in residence, because we've been working with undergraduate medical students at Imperial to invite them to think about the clinical consultation as a close-up live performance with a very small audience, where again, these things like making eye contact, like capturing people's attention, like making sure that they leave with the kind of experience that you wish them to have had, all these are elements of performance, and all these are elements where people who have spent a lot of time thinking about what it means to perform online have a great deal that they can offer us. But I want to just finish by coming back to where I started, really, because I've been writing and thinking and over the last 45 minutes talking about what it is to be expert. But there are questions, aren't there, about why we need experts. We hear a lot about experts. Of course, we've been hearing a lot about experts over the last year or 18 months, particularly in the context of COVID, whether it's epidemiologists, whether it's people talking about education or travel industry or hospitality, all kinds of things. And so we need to, I think, have a sense of what it means to be expert and why we need experts. And I think there are two reasons. One is we need experts for the things that we need to do or have done and we can't do them ourselves, whether it's flying us around in aeroplanes when that becomes possible, or having operations when we need them, or going to see people performing on the stage, or going to plays or whatever, or whether we need people to help us fix our car when it goes wrong, or sort out the central heating when our boiler blows up. In every area of life, there are people we need to do things, and we need to know that they are expert. But the other reason, of course, is that we are, all of us ourselves, on that path towards becoming expert that I've outlined. And I think most of us, all of us, are on many different paths at the same time. It might be our professional world, it might be sport or languages or music or other kinds of things that we're interested in and we really want to get better. But they are in different and sort of different areas of our lives. But whatever it is, I think it's really helpful to have a sense of what it is to become expert. Now, partly that's because we need to make judgments about how much weight to place on what people who purport to be expert are saying. We need to be able to work out for ourselves whether people who say they are experts actually are, because I think a lot of people who say they are expert may not be, and certainly a lot of people I would call expert wouldn't describe themselves as experts, so it's not as simple as it might sound. But I think whichever way you look at it, it's pretty safe to say that by the time anybody has become truly expert, they've spent a very long time learning how to do it. So if somebody says they're expert, but they've only been doing something for 6 months, I think it's a pretty safe bet that in these terms they're not yet expert, because you need to go through those stages of spending loads of time just buckling down and doing it, and then going out and having those experiences of getting it wrong, putting it right, taking responsibility, and then eventually gathering that all together so that you have not only knowledge and skill but wisdom. We need to understand that path, and I think that all the things that are going on at the moment, with all the changes that are happening with the pandemic, with online interaction, particularly in the world of education, when what it means to teach or to learn or to support students, for example, all these things are looking different in many ways from how they were at the beginning of last year. They all need a sort of understanding of what becoming expert entails. And I've tried to sort of pull those things out in this book and looking at that trajectory. But I think one of the things I haven't mentioned yet is that it's easy to look at the beginning parts and see these stages. But an obvious question is, well, where does it end? How do you know when you've become an expert? And I'm going to leave the last word with Joshua, the tailor, because he put very succinctly something that pretty much all the experts I've spoken to have said, and it seems to me from my own experience that is indeed the case, which is that although you can see where the path starts, you can't see where it ends, because it doesn't end. It's a continual process of becoming better and better and better and getting closer and closer to being as good as you can be, but you will never, of course, reach that point. And so the path to becoming expert has a beginning, but perhaps no end. And Joshua, when I asked him, said, I know that there is no such thing as a perfect suit, but I will never stop trying to make one. Thank you.